The second endocrine disorder, we're going to be talking about disorders of the parathyroid gland. Whenever I say parathyroid, I want you to think calcium. Parathyroid hormone is the major hormone that regulates calcium in your body. So the parathyroid disorders present with calcium disorders. What are the calcium disorders? Too much calcium. Too much calcium will result in what? Remember when you were young, what did your mother used to give you to help you to go to sleep at bedtime? She used to give you milk. Why milk? Milk is so rich in calcium. What does calcium do? Calcium lowers the neuromuscular excitability. Calcium lowers the excitability of your nervous tissue and your muscular tissue. Calcium sedates. Calcium obtuns. Calcium inhibits the action potential. So whenever you have too much of calcium, what do you expect? Kind of inhibited patient. And the symptoms will be your thinking is kind of slow, you are inhibited. This is hypercalcemia. The opposite is when you have hypocalcemia, you're going to be twitchy, and all your muscles will go into spasm, what we call tetany. Causes of hypercalcemia. The most common cause is by far what? Hyperparathyroidism. But malignancy is the second most common cause of hypercalcemia. Malignancy produces, especially at the late stages, any malignant tumor will produce a parathyroid hormone-like particle. And this is a bad sign in the prognosis of malignant tumors. Whenever a malignant tumor starts secreting this parathyroid hormone-like protein, this is a bad sign, this is a terminal sign. Granulomatous diseases, vitamin D intoxication, thiazide diuretics. Can you believe that? Thiazide diuretics, one of the side effects of them is hypercalcemia. Tuberculosis, histoplasmosis, and berylliosis. By far, the most common cause of hypercalcemia is hyperparathyroidism, and don't forget advanced cancer. The vast majority of cases with hyperparathyroidism will just present as asymptomatic hypercalcemia. And please, if it happened and you find high calcium levels in the blood, in the lab test results of any patient, but this patient is asymptomatic, what do you need to do? Nothing. Don't treat asymptomatic hypercalcemia. Treat it if any symptom happens. What are the target organs that could be damaged by this too much calcium? Of course, number one is the kidney. Too much calcium will deposit in the kidney tubules and you're going to get kidney stones, osteoporosis and osteomalacia and fractures, because this too much calcium is taken from the bones. It leaves the bone to go to the blood, so the bones will become brittle. Confusion, constipation, and abdominal pain. So the high calcium levels will move the threshold for depolarization away from the resting membrane potential, leading to inhibitory effect on excitability. Calcium decreases excitability. High calcium inhibits smooth muscle contraction as it inhibits the excitability of the neuromuscular tissue. Hyperparathyroidism, how to diagnose it? Simply elevated parathyroid hormone levels with hypercalcemia. When you have parathyroid hormone high, calcium high, this is going to diagnose hyperpara. How to treat it? Surgical removal, because the most common cause of hyperparathyroidism is hyperparathyroid adenoma, 80% of cases you're going to find solitary adenoma. One of the 4 parathyroid glands will have this adenoma. Remove it. 19% of cases you're going to have 4-gland hyperplasia. All the 4 glands are big and are hyperfunctioning, so remove all of them. In 1% you can have hyperparathyroidism due to a parathyroid malignant tumor. So in hyperparathyroidism, surgical removal of the parathyroid gland is indicated in, and the answer is all of the above. When are you going to remove the parathyroid gland? Symptomatic disease, stones, bones, psychiatric moans, and GI groans. These are the manifestations of hypercalcemia. Stones, bones, psychic moans, and GI groans, abdominal pain, and some psychological disturbances, and bone fractures, and kidney stones. Renal insufficiency, markedly elevated 24-hour urine calcium and very elevated serum calcium, more than 12.5, and the normal, don't forget the normal serum calcium is 8.5 to 10.2, more than 12, this is very elevated. These are the indications of surgical removal of the parathyroid gland. Hypocalcemia, on the other hand, this will lead to what? Increased muscle irritability. The causes: surgical removal of the parathyroid gland. And we sometimes see this condition happening acutely in patients who were scheduled for radical thyroidectomy, total thyroidectomy, removal of the thyroid gland. And with the thyroid gland, the parathyroid might become removed as well. So the patient comes out of the OR with severe hypocalcemia. The patient is going to develop carpopedal spasm and even spasm of the laryngeal muscles and may get some respiratory obstruction. Causes of hypocalcemia: number one, surgical removal of parathyroid gland. Don't forget hypomagnesemia, because magnesium is needed to release the parathyroid hormone from the gland. If your magnesium is low, your parathyroid hormone is low, and consequently your calcium in your blood will be low. Vitamin D deficiency will lead to hypocalcemia. Acute hyperphosphatemia. The phosphate binds with calcium and lowers it. Fat malabsorption. When you have any condition in your gut that leads to fat malabsorption, this will bind calcium in the gut and will decrease calcium absorption, and you will develop hypocalcemia. Sometimes you can have normal parathyroid hormone, but your tissues are resistant to parathyroid hormone, what we call pseudo-hypoparathyroidism that accompanies short fourth finger, round face, and mental retardation. It's a genetic congenital abnormality. Diagnosis of hypocalcemia: severe hypocalcemia presents with the following: seizures, neural twitching, arrhythmia due to prolonged QT interval on the EKG. Seizures, twitching, arrhythmia, hypocalcemia. And the treatment: calcium. What's the problem? Low calcium. What's the treatment? Replace calcium. If there is vitamin D deficiency or hypoparathyroidism, give vitamin D and calcium.